Hi, everyone. Thank you for joining the live event tonight on how corporate ODs can become a fellow with Academy. Thank you, Dr. Africano, for coming on today.
So happy to be here.
Yeah, for those of you that don't know, Doc, he graduated in 2015 from Salis, where he completed an advanced studies in retina program. After graduating, he completed a primary ocular disease residency at the Eye Institute of Pennsylvania College of Optometry. In 2019, he became a fellow of the American Academy of Optometry. He practices in North Carolina. He's affiliated with America's Best for the last 6 years and holds different roles there as clinical advisory, panel member, quality assurance, panel member, university ambassador, area doctor. How do you find the time to do all this? And next, he also has a passion for teaching. So he's also a clinical preceptor for Salis, ICO, Pacific, and NECO. And besides that, too, he has a wife and a 6-year-old. Welcome, welcome.
Thank you, Alex. I'm so excited to be here. This is a phenomenal topic that I'm really passionate about. So I'm happy to get the word out.
Yeah, it's good to get the word out because a lot of corporate ODs, I think, have the ability to join AAO and they don't know how. When did you first consider completing a fellowship with the American Academy of Optometry?
So, that's a great question. I actually think back on that, constantly. I actually remember the moment. It dates back. I was a student, and I think I first was introduced to the academy itself. And when I started going to the academy meetings and getting some of their kind of their information, via email and the website, I was really intoxicated. And I'm like, this is a phenomenal group. There's so much great clinical and academic information coming from them. I wanted to be more involved. And then I, started to learn about, the fellows and fellowship process. And I like to joke, as a student, I thought, a fellow was like a mythical creature. They're, only the best and the brightest. They're amazing clinicians and academics, and they're all teaching, and that's all. They just live optometry, and it was really, a far-reaching goal. That was kind of like a wish upon the star to become a fellow. So it dates back to when I was a student, and then, as my 4 years at PCO and at Salis kind of progressed, and when I became a resident, I started to talk with more fellows and get some more information about the academy. And I realized that this impossible goal was actually something that's achievable, and something that's very reasonably achievable. And I was really excited to kind of pursue that.
Great. What led you to pursue fellowship?
So, I think there's a number of different reasons to do that. And I think each fellow has a different reason to kind of be motivated to reach that goal. For me personally, it was going to be that lifelong pursuit of knowledge. I've always been someone to kind of, read the textbook, front to back at every bit of piece of information, because I feel if I can better my knowledge base, I can, accomplish whatever I'm trying to achieve to my utmost, and, achieve that the best I possibly can. And, as clinicians, as doctors, I think we owe it to ourselves. I think we owe it to our patients to, reach those far-reaching goals as well. And and that lifelong pursuit of knowledge, that continued, goal to look into the newest research, look into new practice, management options and treatment modalities. That's what the academy and fellowship meant to me. And I knew if I pursued that and went down that avenue, went down that route, I would continue to grow as a clinician outside of school, outside of residency, outside of a clinical preceptor. I would continue to grow no matter what environment, no matter what mode I was practicing in, and I would be able to perform the best optometric care I could. And that's what my personal motivation was, to pursue a fellowship with the academy.
Did working in a corporate environment defer you from completing this process? I think there's a lot of myths out there in the industry about that.
It's actually funny. I always thought that the majority of fellows would absolutely be in academia, but actually, when you look at the academy makeup, it's a lot of doctors, outside of just in general practice, private practice ODs, group, corporate, that large grouping. It's actually about around 60% of the academy are non-academic docs. So when I made that transition from residency into a corporate setting with the National Vision Doctor of Optometry Network, I actually was the opposite of deterred, because I continued to see these amazing cases walk in every day. And I only thought those cases were going to pop up during my residency, or once in a lifetime. And I would have a patient sit down, I would work with that patient and go, well, this could be a great, case report. I've never seen this before. This would be a great write-up. I would love to learn more about this. So I actually felt in my personal setting, in my corporate setting, that I was seeing the pathology, that I had the time to delve deeper into these really interesting cases and expand my clinical and academic knowledge and pursue, that fellowship. So I actually think the corporate setting actually, in my case, helped. But I think it's going to be certainly different in every practice environment.
Yeah, I think it's one of those big myths out there that, corporate optometrists don't see anything medical. They just do kind of routine eye exams. And I think that myth is really busted, with a lot of doctors being able to practice the way they want, see patients, dive deeper if they want to, or send it over to their colleague. It just depends what you want to do. And a lot of doctors have specialty practice within this setting. So it's kind of nice that your network, you're able to see these patients and able to, use it towards your fellowship. So doctors that kind of thinking about it, then, they have you as an example to be inspired to do more, because you were able to do that within your network. What entitles the process of applying and completing a fellowship?
Sure, and that's another thing. Once again, dating myself when I was a student, I felt like it was going to be this epic, process to kind of get this completed, and it's actually relatively simple. So first off, obviously, everything's going to start off with an application and a little bit of research into the Academy website, and they really lay things out phenomenally well. It's really easy to kind of follow their timeline and follow the process when you go into the Academy website and look into fellowship. To give you an idea, after the application process, you really need to acquire 50 points. Generally, I would say the bulk of points that the average doctor would acquire is going to be from case report submissions to your subcommittee chair, and the academy itself, as well as some poster presentations. And so you're going to need 50 points to move forward, and each case report or poster is 10 points. What really helped me, and I think what helps a lot of doctors out there, is a residency actually will achieve you 20 points. So you're almost halfway there if you've completed a residency. And that's why I think if you've done a residency, go the extra mile. Just push a little bit further and move forward with the fellowship. I think that's that was my expectation once I completed my residency, and that would be my strong suggestion for residents out there. But once again, so case reports, poster presentations, that will achieve 10 points, the residency 20, and then there's a number of other things that can achieve some points, some article submissions and things along those lines. After you've acquired and successfully passed with the 50 points, that would lead you to move forward into your oral examination. And that's going to be held each year at the Academy meeting. And of course that, moves around the country. And that, some people get really nervous with the oral examination. I've sat for the North Carolina board review, board exam. So I was kind of ready and prepared for kind of having that oral conversation about clinical cases. But what I like to look at it is just kind of delving deeper into the cases that you presented. And you want to, I like to discuss the cases. So this was an example, and I'm time to do that with these doctors that, thoroughly read your case reports and reviewed your poster presentations and kind of looked into what you did with residency. So it's really, it's just a conversation and discussion about what you presented, what you discussed, and why you did what you did. Why did you manage this patient as you did at the time? And would you potentially do anything different? If you've looked into the most up-to-date research and maybe you saw the patient 5-10 years ago, there's different practice management plans right now. Would you do anything different if you saw that patient today? And you have that conversation, and typically if you can defend the cases and what you submitted to the committee, then of course you pass and you would become a fellow at that meeting. And it's like I said, it's a simple process. Acquire those points, sit for the oral examination at the the annual academy meeting, and you too can become a fellow.
Did working in a corporate environment make it like the process more difficult, or?
That's a great question, because I initiated the process in academia, completing it when I was working for Salus University at the Pennsylvania College of Optometry's clinic. And so I was in that setting, and then I made the shift. So I really achieved about half my points in academia, and then I went to corporate. And initially I was like, is this going to be something that's obtainable? But like I said, the first thing is I had the cases. I had pathology and intriguing cases walking in all the time. So I had that component, and I'm actually still seeing cases and building poster presentations for the Academy. I have a really great case that I'm hoping to present probably in a year or two once I get all the data. But like I said, so the cases are there, the patients are there. I think there's two components of really completing the fellowship. It's having the clinical portion of it, and then having the time. And what I felt in my corporate setting is I had that work-life balance that I can be done at the end of the day, and I spent some time with family, and I was able to delve deeper and do the research and do the work, get down dirty with these cases, so I can grind out some of these case reports and work on these case reports. So I actually said I feel like if you're in a retail or a corporate setting, you actually potentially have more of an ability to delve deeper into these cases and do the work to create the posters or write up these case reports. So I don't think that a corporate setting was an obstacle in any way. It might have more been a benefit to maybe move forward with the the fellowship with the Academy. So I think that was great.
I mean, we see a lot of medical cases, so it's just a matter of you sitting down and doing it after. And so a lot of doctors will work, 4 days a week, and that's full time within a corporate setting. Or if they have a sublease, then they'll hire another doctor, so that you have time. You just got to have the passion to do it. So if you want to do it, you can always find time to do something. So
exactly.
What type of cases can you use?
That's great. And I speak with students and other doctors that are interested in a fellowship all the time, and they're like, I've seen this, once in a lifetime cases. Is this what we're really looking for to submit for a case report or create a poster? And I might be a bad example. One of my poster was on coats. I had a positive Slosman case for one of my case reports, but my third case report was actually on a lamellomacular hole. And how often do you see macular holes? And, that's something that you can see, once a week or once a month or multiple times a month. These are common conditions. And I think the misconception is you have to have these esoteric, once in a lifetime, brilliant cases to submit. And that's certainly not the case. What I usually discuss is, if you come across a patient or a case or a condition that you're interested in, want to delve deeper in, that's potentially a great case. And then the second thought that should come to your head is, if someone's reading this case report, will this intrigue them? Will this, make them want to, be a real page turner? And if that's the case, that's a phenomenal topic. You don't have to have, a once in a lifetime case. It can be something that you see every day or once a week. It can be a tricky glaucoma case. It can be a recalcitrant dry eye. It can be, something that is commonplace, but that you hit that second tier with it. You hit that secondary and tertiary knowledge. And it's really a factor of what you bring to that case report in your management and the research that you bring later on that will make it a good case report. And, if all else fails, you can contact your subcommittee chair and the committee. There's going to be a mentorship process within the Academy. So these are all resources that you can, utilize to make sure that these cases or patients would be great candidates for a case report or a poster.
Yeah, I mean, I think it'd be easy to find case reports in corporate optometry, America's Best, because we see a lot of patients that haven't had usually care within a few years. They usually come seek us out first because we're pretty easy to be seen. We make it easy to have patients be seen pretty quickly. You said the macular hole, and I mean, that's pretty easy. A lot of patients, we all have those in our offices. So it doesn't have to be the complicated things. But am I correct where I'm saying it was pretty easy for you to find case reports at America's Best?
Oh, absolutely. And actually, on that note of that, and I'm still seeing cases to this day, like I said, that would be a good poster or a good case. And one of the big suggestions in this, I can't take credit for this. This is one of the other doctors that's on the membership committee. She always suggests that, if you're interested in the process, and even before your application process, as you're going through your days and your weeks, if you see an interesting patient or interesting case, jot the patient's information down, jot the the clinical presentation down and what made it interesting, and then after a few weeks, after a few months, kind of compile that information and look back into it and see which of these patients may be a good option to create a case report. Like I said, I always suggest you might have had something really rare and difficult, or you might have had something that you're interested in delving deeper in. And if the latter is what I would really write that case report up on, because once again, these case reports are something that's going to be, an academic presentation, but it's also something that should improve you as a clinician. And if the once in a lifetime case comes up, you're probably not going to see that again. But if it's something that you're working on every week, and you do this research and you do this work to make yourself a better clinician and professional, that's going to actually impact you as a doctor. That's going to impact your patient care. That's the case to do. And like you said, this is something that you're going to see quite frequently and will be interesting for the reader and will improve your clinical skills.
I think you've done a bunch of case reports now. How long does one actually take? Does it take a few months? Or, I mean, you're kind of like a pro now, but someone starting out, well, how much time would you say they'd have to invest to start? And then obviously they have to prepare for the test and things like that.
Yeah, absolutely. That's a great question. And I think each case report's a little bit different depending on how much, how far you have to delve into kind of get additional knowledge. When I first started working on positive Slosman, I was like, I kind of know about this condition, but I actually had to teach myself, about the condition itself and its potential etiologies and kind of its adverse effects and things along those lines, and all the different management options out there. So that, that certainly might have took me a little bit longer, but something that's more commonplace that I was kind of comfortable with, like a lamella macular hole, I certainly had to do less of the early kind of groundwork to kind of create that case. And like I said, in our setting, it's typically when you have that free time, when you have that ability to kind of work into it or delve deeper into it, it probably takes a few weeks, I would say. You spend that first week on your free time kind of looking into the case, building that groundwork, that foundation to make sure that you understand the condition and the management care for it appropriately. And then those subsequent weeks, just kind of building on that foundation, kind of discussing and kind of defending what you did and why you did it, and kind of writing the whole process out. What's really, really wonderful is the Academy does give some case report examples on the website. That was a huge resource because I've certainly, I initiated the process when I was in residency, but I actually took another pretty much 1.5 to 2 years before I submitted that second case report. I got rusty pretty quick. So I kind of lost a little bit of my chops and kind of writing, longer papers like that and kind of doing that additional research. So the resources that the Academy provided really was a great refresher and gave me really great examples on how to write not only a case report, but a good and appropriate case report, and something that you could submit, at a later date if that's something that you would be interested in. So long answer to that question, but usually probably a few weeks to about a little over a month of kind of work on that, just, spending that on your free time.
It's really not a big commitment. And then as you start to do it more, you get, it's faster to do. It's like you said, you got a little rusty. It's the same thing as you're doing something else, right? So it's just a matter of having that passion and reserving that time to do it. And sometimes it is, if you have a great case, you have that, you can share it with others. Because, other people are learning from you too. So we're all becoming better doctors from it. What are some advantages that a fellowship brings?
Absolutely. And I think there's professional advantages. I think there's personal, growth and advantages. For me, it was, knowing that I went through the rigorous, demands and kind of the process of becoming a fellow. And I knew that I grew myself as a clinician and a professional, and that I can provide, that premier care to my patients. So that was my personal advantage. Of course, a fellowship really brings that distinction. And, it indicates something to yourself. It indicates something to your colleagues, and maybe probably most importantly, it indicates something to your patients that, you've pushed yourself as a clinician, you push yourself as an academic and professional to really, rise above and beyond to be a clinician. And that FAO at the end of your name, indicates all of that, all the time. So I think it's something that brings a lot to the table on both a clinical and professional level.
Do you feel that fellowship is beneficial in a corporate setting?
Absolutely. And and that's not why I accomplished it. Like I said, for me, it was, increasing my knowledge base and becoming a better clinician. But I mentioned it before, distinction. There's a lot of optometrists out there, and so every corporate, optometric networks are a little bit different. The National Vision Doctor of Optometry Network, I don't know what some of the other networks are, but we're well over 1,000 doctors, 1,300 doctors. And having an FAO at the end of my name really brings a greater distinction and separates myself from a lot of those other doctors. So it's interesting. Every pond, every pool is a little bit different. I'm in a little bit of a larger pool, so having that increased distinction really helps. And it's something that I took pride in, and I think they did as well. And I really appreciated that.
Yeah, I'm sure. Yeah, it does differentiate yourself from others. And then I feel that having this also gets you networking with other like-minded professionals, and just you challenge yourself to be the best clinician, best doctor, and be on top of the latest technology and education out there. So I think that's important as well. What are some tips you can give doctors about, considering applying for a fellowship?
Absolutely. I probably can give an endless list, but I really think the thing that always really jumps out at me, and if I'm discussing with a colleague or like I said, or a student that's interested in pursuing a fellowship with the academy, is don't wait. If you're interested in it now, once again, go to the academy site. They have wonderful literature there to kind of walk you through the process. My biggest tip, excuse me, is don't wait. Look into starting the process. Look into reaching out to a mentor to kind of grow, develop and kind of move forward, and just dive into it. Dive into the deep end with it. Excuse me, I don't want to blow everyone's mics out. If the longer you wait, the easier it is to say, this isn't something that I really need, or something I'm not really passionate about. And so I really suggest, if you're interested, kind of dive into it, start the process, start building up your repository of potential cases. It can be a slow process. You do have 3 years to achieve those 50 points and move forward with the oral examination. So you don't have to jump in right away. Start the process, get that application in, determine what cases you might be interested in, determine what cases are coming into your exam chair, and that might be good case reports or poster presentations, and kind of just initiate that process as soon as you're interested. Because life gets busy, and the longer you're at a school, the longer you're in a practice setting, sometimes you may lose that motivation. And I think it's the worst if doctors that are interested or start the application process and don't complete it. That's just such a loss, because you're so close already. Just go that little extra mile early on. Kind of push yourself, and I think it's a wonderful accomplishment, both personally and professionally.
Yeah. I went to the academy meeting a few times. It's a different meeting. It's different content. I mean, you meet different doctors. What was your experience that when you've attended the academy meeting?
So that's what really enticed me with fellowship and the whole process. And I was blown away. It's just it's a plethora of knowledge sharing, and once again, it's a great networking event, either professionally or academically, that kind of builds yourself up as an optometrist and a clinician. I go as much as I can. I have a 3-year-old, and I have another one on the way. So sometimes it becomes a little hectic, but I really try to make the time to go to these meetings, because I really feel like a better doctor, a better clinician, a better optometrist as soon as I get back home. And what I really love, and I think this goes without saying, if you go to a society meeting or go to some CE, once you go back to the work that next week, you feel like an ace optometrist. You're catching things that you've never seen before, or utilizing that new knowledge that you just picked up. And I always feel like the premier optometrist after I leave an academy meeting. So I really think it's a wonderful event. If you've never been to, absolutely suggest you go. And if you're a student and you start going now, keep going as a professional later on, because I really think it will help you grow as a clinician.
You talked about differentiating yourself in a corporate setting within large networks. What was the response within National Vision Doctor Network when you completed your fellowship?
Yeah, so I was really blown away. I thought it would have, I might have, had a conversation here or there, and kind of interested in the process, and then it would kind of, peter out. There was a huge celebration for me. There was Reid Foz, the CEO of National Vision, and since I'm an affiliate, and I'm in the National Vision Doctor of Optometry Network, Reid Foz was, I think, talking me up at our annual CE meeting that had over 1,200 doctors there. And he was just really showed a great amount of pride and really was impressed with the achievement of, me pursuing the fellowship and, really trying to advance clinically and professionally. And that really, to sound cheesy, it really warmed my heart because I was blown away by the impact that it had on that group, and I couldn't be more thankful. And it really reinforced, all the work that I put into it, and my initial hope of it kind of, making myself a better clinician and doctor. And they really made me feel very happy with that achievement. So I was really impressed and happy.
Yeah, you should be proud of yourself. And within corporate optometry, the doctors are part of the network, right? Too, right? I mean, the doctors are part of their growth, their achievement as well. So it's great to see, corporate opticals recognizing doctors and recognizing achievements that, some doctors might not have do that, but he also encourages other doctors probably to do that by, presenting to you. And if you were able to not turn red during that presentation, you did a good job. So, but I think that's great. I think there's a lot of great information here. A lot of doctors that can join Academy should join Academy, and it doesn't matter what setting you're in to do so. And even just to go check out the Academy meeting itself, I think it's in San Diego this year, is just you get some good information, good education as well, and just, talk to different people. And I think that's what's great about optometry. There's so many different avenues you can pursue and do, and Academy fellowship is one.
Absolutely. Even though no matter what environment or mode you're working in, we all have the same goal. It's patient care, and it's helping people see and being able to live their life to their best. So no matter what environment you're in, whether it's corporate like myself, and pursuing a fellowship, and like I said, absolutely, Maria, looking into Academy meetings and growing as a clinician, I think these are great avenues for professional and clinical growth, and I don't think you can go wrong.
So if doctors have questions, can you provide like an email address, or they can connect with you on LinkedIn?
Absolutely. Yeah, please. Robert Africano at LinkedIn. You can always, please, join me. I post Academy and some information about the National Vision Doctor of Optometry Network. I like to think my content's good, but I'll leave it up to you to decide.
It's always good. It's different. It's good. Anyone that posts, everyone's different perspectives always appreciate, I think, because there's always somebody that you can connect with that, needs advice, or might think alike. I think like-minded people need to connect in the industry, and not just one person presenting content all the time.
Absolutely. Yeah. So please, you can always reach out to me there. You can reach out to the Academy directly. You can reach out to the membership committee. We do have information, Zoom meetings that you're always, happy to attend if you have questions. We answer a lot of questions there. I know we've had a few within the last few months about doctors in corporate settings that were interested in fellowship. I think those are phenomenal resources to get more information other than what I just provided about the Academy itself, about the process. We have some really phenomenal doctors on the membership committee that have a lot more tenure than I do, that understand the process and all the intricacies, and can really guide interested doctors in achieving that. But once again, reach out to the Academy, the membership committee, or myself. Always happy to help you with that process.
All right. Thank you so much for joining us today and giving us the information.
Thank you for having me. I think it was a great time. Thank you.